a very dynamic team. And if you have ever worked with them, you will know. This initiative is really something that is initiated within that pharmacy department. As you know, at different stage of your life, you have a different wants. When you are teenagers, you want to go into university. When you graduated from your university, you want to get your first job, the first car, the first house, that first girl, right? However, if today, if you are diagnosed with cancer, what are your priorities now? And that is what hit us at the Princess Margaret Outpatient Pharmacy. In the past 20 years, as we all know, that a lot of incurable disease are now cured. I was just talking to Dr. Ward that we all both joined the Princess Margaret Hospital at 500 Sherborne in 1982, many years ago. At those times, not many diseases are curable, but in the past 20, 30 years, many diseases are curable. And yet, the challenge is the cost. And you know, in the past 30 years, the cost had go 10 times. I remember the $2.5 million drug budget then, but now it is like 20 what? Fifi? $25 million, $30 million, okay? In outpatient pharmacy, we see many, many patients in the ambulatory care. Now, inpatient, just leave it aside because it's funded, right? Outpatient, it's not. We dispense somewhere 350 to 400 prescriptions a day. And we dispense over $20 million of prescription drug there. Imagine that maybe 50% is paid for by Ontario Drug Benefit, 50% is not. They have to be self-carried by the patient. They either have third parties payment, they either have to pay cash on their own, they are deductible. If one drug costs you $50,000, 10% deductible, it's what? Think about it. Can you afford it? So this is a very personal question. It's not just for the patient that is at Princess Margaret, but it's for everybody sitting here. Because I'm sure you have family member, friends, close relative, people who, one way or the other, touched by cancer. I have. And so as the Princess Margaret Hospital outpatient pharmacy staff. So one day in early 2010, one of the patients come to our manager, Karen Chuck, and say, Karen, I really have been struggling because should I really pay for this medication to survive, or I should pay the mortgage so that my family can still continue to stay in the house? That really is one-time thing that really triggered our whole entire team to think, there has to be a better way to help these patients. We just cannot be doing dispensing and looking at clinical data and all that. Somewhere in between, something has to happen. At that time, there's no consolidated, centralized system to help the patients. So we really put our head together, Karen and her team and us, and say, well, we should establish a medication reimbursement specialist position. But you know funding is hard, right? So we have a 3-year, we are doing a 3 years trial, okay? We got the approval from Malcolm, the chief of medical oncologist, and say, go ahead and do a 3 years pilot. It's a temporary position. If it's not good, we're gonna yank it, okay, fine. You know, so that's Malcolm. And the thing is that at that time, one of our technicians, Yvonne Tai, right there, she was a permanent full-time technician at the Princess Margaret Hospital. She and Karen Truck really worked together as a team. She quit her job as a permanent status technician, give up the security, joined this 3 years pilot to be a temporary position, medication reimbursement specialist. And I really take my hat off to her, and we were all shocked. I say, what? Why are you doing that for? And you know why? Because she is touched by her family member having difficulty going through all this issue. So, but you know what? In 6 months' time, we are helping over 120 patients. Over a year's time, we help over 250 patients. We have 3 business reviews. At the 18 months of business review, we reported we are helping 500 patients. And Malcolm said, stop, Esther, don't waste your time. It's done. The concept is proven. The proof of concept of the medication reimbursement specialist is done. You can just go ahead and hire this person, but find your own money. So I said, all right then. So we are very pleased that I am changing, Yvonne's status from temporary to permanent. Now she will regain her benefit and all that. And for your information, this year I hired a second medication reimbursement specialist. And I'm thinking of hiring the third, the fourth, and the fifth until all the patients coming through our outpatient pharmacy will get this help. And let me tell you the success rate on this. We have 98% success rate of getting all the medication covered. We did, in 2 years, we did over 800 and something prescriptions. And within 3 days, 25% of this group of patients will get their medication from prescribing and have the medication in their hand. And there's 50% in 7 days to have the drug access, and 78% within 2 weeks. And that is really amazing. Like, this is a system that we need in every single cancer center to help our patient, because these are real people really needing help. And the thing is that because this is so successful, we also transcribe this whole program to our organ transplant at the Toronto General Hospital site. We have one medication reimbursement specialist there, okay? And we are thinking of moving that across to the Toronto Western and everywhere, because this is a really well worth proof of the concept to have an outpatient pharmacy, to have this navigator there. So is it sustainable? Well, if you have an outpatient pharmacy, it is, because the cost avoidance for those 2 years for the patient is over $2 million alone, okay, for those 500 patients. And you know what? With the little of dispensing fee that we are getting, we can sustain. Now, we're not earning money. Don't get me wrong. I'm not here to earn money. This is cost avoidance for the patient, to get the insurance to cover for the patient, to get the Trillium program where the patient doesn't have that yet. So this is a program of passion, and it's the whole entire team at the Princess Margaret Cancer Centre outpatient together get this done. So what is our goal in here? Our goal is to communicate this idea and concept to all of you, and hopefully that it will become a standard of practice in all cancer centers if you have an outpatient pharmacy there. I think it should be, because the patients are struggling and we need to help them. One more thing I want to tell you, why I love working at the University Health Network and Princess Margaret. The team at the Princess Margaret has a fun. You know how you have patients that really cannot get any medication and fell through the crack? They will go to provide lectures. They will go and provide sessions for education. They earn that $200 or $300. They put it in the foundation fund. So when they see a patient come through the door at the Princess Margaret Outpatient Cancer Center, if they are in need, they will give the drug free of charge to them with that fund. So it would not be infringing to the drug budget, you know what I'm saying, from the Ministry of Health. So I think that is passion to the extreme. So I thank you very much for your attention.